what's effective. But why are we even talking about oral rinses at all? And the reason is that we need evidence-based research in order for us to treat our patients most effectively, and also to help to prevent our getting serious infections and our patients and the rest of our staffs getting serious infections. So there's a lot at stake here, and it's not just about a rinse. So uh, just a little housekeeping to let you know that, as Dr. Rowling had pointed out, that I am affiliated with ioTech International, and we do produce mouth rinses as well. Okay, so let's examine this concept of brushing and flossing. So, since we were in dental school or dental hygiene school, we were inculcated with the mantra brush and floss, brush and floss, brush and floss. So it was ingrained in us. It's ingrained in our practices. We promote that philosophy to our patients, and nothing wrong with that. There's plenty of evidence to show that brushing and flossing is important. But we also ought to look at the full scope of data that's out there and consider what is the difference between at-home brushing and rinsing compared to at-home brushing and flossing. Well, there were three robust, randomized, controlled, evaluated, blinded studies. These were gingivitis studies. Of the three studies, one had more than 300 patients. Study number two had more than 300 patients. And study three had 160 patients, all comparing the efficacy of brushing and rinsing at home compared to brushing and flossing. In study number one, the group that brushed and flossed wound up with a 2.1% plaque reduction, while the group that brushed and rinsed, remember this is over 300 patients, the group that brushed and rinsed wound up, instead of a 2.1% plaque reduction, they wound up with a 37.5% plaque reduction. And in study number two, also with more than 300 patients, the brushing and flossing group wound up with 3.4% plaque reduction compared to the 20% plaque reduction with brushing and rinsing. And in study number three, where they compared the effect on three different gingival indices. One was the modified gingival index, the other was the bleeding index, the third was the plaque index. And they compared brushing and flossing to brushing and rinsing. And for each of two different rinses that were tested in that study with 160 patients, they found that the essential oil rinse, which was one of the two rinses, and both the essential oil rinse and the chlorexidine gluconate rinse, both of those rinses had a better effect on these gingival parameters than was brushing and flossing. That applies to the plaque index, it applies to the modified gingival index, as well as the bleeding index. So in all cases, brushing and rinsing was more effective than brushing and flossing for plaque reduction. So let's examine chlorexidine gluconate. And we all know chlorexidine gluconate. We've developed strong opinions about chlorexidine gluconate. And so we do know that it's active against both gram-negative and gram-positive bacteria. It's also active against aerobic and anaerobic bacteria. It's been awarded the ADA's seal of acceptance, and because it's been around and used in periodontal care for so long, it's been established as a gold standard for chemotherapeutic use for periodontal treatment. So even though chlorexidine gluconate is an excellent antibacterial agent, does not mean that it's a very effective antiviral agent. And in fact, when chlorexidine gluconate was targeting coronavirus in a study to determine whether it can be approved as an antiviral agent for coronavirus in Europe. This study was done by the Faculty of Pharmacy at the University of Lorraine of France. What they did was they took a 5% chlorhexidine gluconate solution, 5% solution, which is 42 times stronger than the 0.12% chlorhexidine gluconate solution we use here in the States. They exposed coronavirus to chlorhexidine gluconate for 1 hour. It's a long time to be rinsing. And they wound up with a 3-log reduction. Well, it requires a 4-log reduction in order to gain EU approval as an antiviral rinse. So they failed that test with that solution that was 42 times stronger than what you use, and also after exposure for 1 hour to the virus. With rhinovirus, our 0.12% chlorhexidine gluconate rinse has no biocidal activity at all, none in 30 seconds. For Fusobacterium nucleatum, a prominent periodontal bacterium, it has a very respectable showing. And for that, they achieved a 4.29 log reduction in 15 seconds. But for Strep mutans, a principal carriogenic bacterium, it only achieved a 0.19 log reduction in 15 seconds. How bad is that? Well, if you start off with 1 million Strep mutans, and after that exposure to chlorhexidine gluconate for 15 minutes, that 0.19 log reduction is the equivalent of leaving over 810,000 viable bacteria out of the starting 1 million bacteria. So not a good showing at all. Other disadvantages of chlorhexidine gluconate, well, FDA has issued a safety warning in 2017 because of a rapidly increasing number of allergic reactions. In fact, 4 infants have died from chlorhexidine gluconate, anaphylactic shock associated with the use of chlorhexidine gluconate. FDA has also recalled chlorhexidine gluconate oral rinse on multiple occasions because of microbial contamination, because of bacteria living in the chlorhexidine gluconate. And if you look at every bottle or the safety data sheet which accompanies every single bottle of chlorhexidine gluconate that's sold in the United States, you'll see that there is a caution that it is a potential carcinogen. That information is required to be placed there by FDA, and they indicate that it's a category 1A potential carcinogen, meaning that the data that was amassed in order to be able to classify it as a potential carcinogen came from human data. We know that chlorhexidine gluconate inhibits fibroblast proliferation and attachment. It inhibits wound healing. If you're doing guided tissue regeneration, it's working against you. We're certainly aware that it promotes dental calculus buildup, that it stains teeth and tongue, that it has a poor taste, or that it alters one's taste, and that it's indicated for short-term use only. It is contraindicated for long-term use. And it also allows microbial resistance to develop, as does many other antibiotic agents. Hydrogen peroxide. Hydrogen peroxide is an oxidative antiseptic oral rinse. It works by oxidation. And the American Dental Association, in their interim guidance for COVID, had recommended 1.5% hydrogen peroxide as a pre-procedural rinse to knock down the chances that you'll be getting or the patients will be getting COVID. But at the same time, that the American Dental Association was recommending that as a pre-rinse. The Center for Disease Control, both on their website and also in their published guidelines for disinfection and sterilization of healthcare facilities, indicates that for rhinovirus, that same 1.5% hydrogen peroxide rinse requires 18 to 20 minutes of rinsing in order to inactivate rhinovirus, a very common upper respiratory virus. Difficult to kill, but very common nonetheless, responsible for most cases of viral pharyngitis, viral sore throats. In the fall of 2020, a whole slew of data became publicly known, which addressed the efficacy of hydrogen peroxide as an antiviral agent. There was an extensive amount of in vitro data, an extensive amount of in vivo data, and the culmination of that, there was an article which was published in the Journal of Hospital Infection in October of 2020, which was authored by 2 different dental schools and also the virology department of the medical school. They did a literature review worldwide of all articles related to the efficacy of hydrogen peroxide as an antiviral agent. And what they concluded was that there is no scientific evidence supporting hydrogen peroxide mouthwash for the control of SARS-CoV-2 or any other viruses in saliva, and that its indication in dental care protocols during the COVID-19 pandemic should be revised. That was in October of 2020. The following month, the public health authorities in Ontario, Canada, and also the Royal College of Dental Surgeons of Ontario issued a warning to all dental offices in Ontario, Canada. Stop using hydrogen peroxide as a pre-rinse, as an antiviral pre-rinse. It does not work as an antiviral pre-rinse. And the following month after that, in December of 2020, the Canadian Dental Hygienists Association issued a nationwide alert, Canada-wide. Stop using hydrogen peroxide as a pre-rinse. It is a poor antiviral agent. We want to talk a little bit about iodine, and it would be useful if we examine the history or recorded history of iodine. And we have evidence of the use of iodine for 5,600 years now, because it was 5,600 years ago that early Chinese physicians recorded the use of seaweed, sea sponges, and sea urchins ground together and made up as a paste which was wiped on patients' necks to reduce the size of goiters, enlarged thyroid glands. And they had no idea that it was iodine that was the active agent in each of those substances. But empirically, they knew that it worked, right? 5,600 years ago. But it wasn't until 1811 that iodine was actually discovered as an element. And that was done by a French researcher, Courtois, and that was in 1811. And since the discovery of iodine as an element, the most prominent therapeutic solutions of iodine were tinctures of iodine. Why tinctures of iodine, which are alcoholic solutions of iodine? Because iodine dissolves readily in alcohol. It's almost insoluble in water. Okay, so it was easy to make up tinctures of iodine. They were very, very effective, but not very patient friendly. Because if you ever got tincture of iodine on an open wound, you'll know exactly what I'm talking about. It burns and it stings. because of the alcohol, not because of the iodine. So not very user-friendly. And in the early 1920s, iodized table salt was introduced. Why? Because iodine is an essential nutrient. All mammals require iodine. If we don't get enough iodine in our diets, we suffer from iodine deficiency diseases. So in the early 1920s, it was established that by the public health authorities in many Western countries that by iodizing salt, either mandating it or recommending it, that it can help as an inexpensive public health measure to make sure that we get adequate quantities of iodine in our diets. 1955, NASA scientists developed povidone-iodine, an iodophore. And so that's your betadine, povidone-iodine. And the reason that they developed it was because they were looking for the most effective, the fastest acting, the broadest spectrum antiseptic agent to take on space missions. And because alcohol is both flammable and explosive, they couldn't take tinctures of iodine on the spacecraft. So it was NASA scientists that actually developed povidone-iodine, and they did it by combining a large organic molecule, polyvinyl pyrrolidone. They combined polyvinyl pyrrolidone, which is extremely soluble in water. It goes immediately into solution. And it also has the ability to physically complex with iodine molecules. So because iodine molecules are complexed or bonded in a physical way to polyvinyl pyrrolidone, when the polyvinyl pyrrolidone goes into solution, it drags the iodine molecules, kicking and screaming, into solution with it. And that was the beginning of the water-based solutions of iodine, povidone-iodine, and in the ensuing years, it has become a standard of care in infection control around the world. There has not been a major advance in iodine chemistry for the next 65 years. In 2017, molecular iodine dental rinses were developed, and we'll talk some more about that, and which was an important advance in iodine chemistry. Okay, so it wasn't just early Chinese physicians that had that brought to our attention iodine compounds for therapeutic use, but during the COVID pandemic, the Chinese Ministry of Health published a 68-page handbook talking about how to treat COVID patients with their experiences, and also what to do if there is occupational exposure to COVID. And that handbook they had published and translated to a dozen different languages and disseminated to public health authorities around the world. On page 13 of that handbook, they list 4 possible occupational exposures to COVID-19: skin exposure, sharp object injury, exposure of mucous membranes like the eyes, or direct exposure of the respiratory tract. In every one of those cases, everyone, their go-to solution is povidone-iodine. The ADA not only made recommendations in their interim guidance for COVID for pre-rinses, but also for hand hygiene. And their recommendations were to use regular soap frequently. Even better than that, use an antimicrobial soap. And even better than that, use an alcohol hand rub. Well, there had been published in the Journal of Hospital Infection an article which compared the antiviral efficacies of 9 different hand sanitizers used in hospitals. 9 different ones. 3 of them were alcohol hand sanitizers, the rest were not. The second most effective hand sanitizer as an antiviral agent against feline calicivirus in this case, which by the way is a surrogate for norovirus, which you may know as the cruise ship virus. Norovirus, even though you may hear of E. coli, salmonella, and listeria as important or prominent foodborne pathogens, it's actually norovirus, which is the most common foodborne illness and also the most troublesome. Norovirus accounts for 22.5 million of the 48 million cases of foodborne illnesses each year in the United States. So when they test for feline calicivirus, they're actually trying to test for norovirus. So the second most effective hand sanitizer that was tested was a 99.5% ethanol solution. That 99.5% ethanol is far too concentrated for you to want to put it on your hands because they would dry out instantly. Yet, a 10% povidone-iodine solution was 67 times more effective than the most effective ethanol hand sanitizer, right? And it stands to reason why surgeons around the world scrub with povidone-iodine, because it's time-honored and proven as a super effective hand sanitizer. When we compare povidone-iodine, PVPI, to chlorexidine gluconate against 6 different periodontal bacteria, in this series of experiments, what they did was they took a cocktail of 6 different prominent periodontal bacteria: Porphyromonas, Tannerella, Actinobacillus, Prevotella, Fusobacterium, and Streptococcus. And they exposed it to either chlorexidine gluconate or to povidone-iodine. When they exposed it to chlorexidine gluconate, after 60 seconds, more than 1,000 viable bacterial colonies still remained. When they exposed it to povidone-iodine, within 15 seconds, 1/4 the time, all of those bacterial colonies were destroyed. Povidone-iodine is also effective as an anti-caries agent. And in this clinical study, which compared the effectiveness of povidone-iodine to a placebo group, if this was for infants that were at high risk for early childhood caries. Now, they didn't yet have caries, but for these infants, there were 83 of them, ages 12 to 19 months. The study took 1 year, 12 months in duration. The inclusion criteria was that there had to be a minimum of 4 maxillary primary incisors erupted. The patients needed to be caries-free at the time of the initiation of the study, and they needed to be on a nursing bottle with a sugary liquid, a cariogenic liquid, and also to throw into the mix to make sure they had plenty of cariogenic bacteria in their mouth. They needed to have 2 successive strep mutans positive cultures from their dental plaque, right? So the treatment consisted of topical applications to the exposed dentition once every 2 months, 6 applications over the course of the year. Topical applications to the exposed dentition. The placebo group did the same thing, only instead of using povidone-iodine, they used a placebo solution, a applied topically every 2 months for a total of 6 times in the course of the year. At the end of the year, in the control group, 54% of those infants remained caries-free. In the treatment group, 91% of the povidone-iodine treated patients were caries-free. Many of you are using minocycline microspheres, locally applied. There was studies in both the American Dental Association, in JADA, their journal, and also in the Journal of Periodontal Research, which shows that actually a subgingival infusion of povidone-iodine gives a better clinical attachment gain compared to the deposition of minocycline microspheres. Povidone-iodine is not only effective against periodontal bacteria, it's also effective against periodontal bacteria within a biofilm. At the Department of Periodontology at Tokyo Dental College, they found that with a 30-second application of povidone-iodine, that was effective in suppressing both Porphyromonas gingivalis and Fusobacterium nucleatum in a dual species biofilm within the periodontal pocket, within the biofilm lodged in the periodontal pocket. Iodine is not or does not cause bacterial resistance to develop. But chlorexidine gluconate does. There were 2 literature surveys, one in the International Journal of Clinical Practice, the other in the Journal of Clinical Practice. And both of them report that in scouring the published literature, there is no evidence that that iodine causes bacterial resistance, but there's a ton of citations that chlorexidine gluconate does. So the International Journal of Clinical Practice reports there have been no clinical reports of microbial resistance development in response to povidone-iodine treatment, yet there were numerous citations of chlorhexidine-induced microbial resistance. And the Journal of Clinical Practice reports iodine is not associated with the selection of resistant bacterial strains, but in contrast, bacterial resistance to chlorhexidine is well documented. We're interested not just in the immediate effect, but also in the residual effect or the lingering effect of whatever active agents we're using. So we're particularly interested in the substantivity. We know that chlorexidine gluconate has a good substantive effect, but in this study, which was published in the Journal of Clinical Oral Investigations, they found that while chlorexidine provided a temporary decrease of the subgingival microflora for 7 days, this is with a single subgingival irrigation. Povidone-iodine, the effect lasted more than 4 times longer at 31 days. All right, so they were both substantive, but the povidone-iodine lasted considerably longer. Professor Jorgen Slotz, one of the preeminent periodontists of our time, has studied the activity of povidone-iodine and its use in periodontal therapy for decades. And he's reviewed hundreds of studies over the years. And his conclusion is, by the way, Professor Slotz was a previous chairman of the Department of Periodontology at University of Southern California Dental School. He's an advisor to the World Health Organization, to the Food and Drug Administration. And his message is that povidone-iodine is a first-choice antiseptic in the management of periodontal disease, that because of its excellent antibacterial and antiviral properties, that it's been safely used in periodontal therapy for decades, and that it's well accepted by most dental professionals and dental patients. And Slotz cited dozens of different studies in drawing his conclusions. A couple of them I've highlighted for you. One had to do with the reduction of pocket depth, periodontal pocket depth reduction. How? By either flap surgery or by ultrasonic scaling with povidone-iodine as the irrigant or coolant. Flap surgery or povidone-iodine as the coolant in ultrasonic scaling. And what they found was that for pockets up to 7 millimeters in depth, there was no difference. That the ultrasonic scaling with the povidone-iodine coolant was just as effective as flap surgery itself. In another study that was performed for the efficacy in early childhood caries, this one, instead of 1 year in duration, was for 12 months, was for 6 months in duration. Same infant age group, 12 to 19 months of age, and also similar to treatment protocol, a once every 2-month application of either povidone-iodine in the treatment group or placebo to the erupted dentition. And they did this for 3 times over a period of 6 months. And what they found was, at the end of that 6-month period, fully 1/3 of the control group had developed caries and none of the treatment group developed caries. In another study showing the effect on bacteremias, periodontal bacteremias, what they did was, prior to a traumatic procedure like an extraction or a intraligamentary injection, they did a single infusion or subgingival irrigation with either povidone-iodine or chlorexidine gluconate, or as a negative control, sterile water. Right? So either one of those 3 things was done before that extraction or intraligamentary injection. And what they found was that the lowest levels of bacteria in the bloodstream came with the infusion of the povidone-iodine, and that the levels of bacteria in the bloodstream were equally high with both the chlorexidine gluconate and the sterile water, and that chlorexidine gluconate had no better effect than the sterile water. When we talk about periodontal bacteremias, we're certainly aware about the systemic implications that periodontal bacteremias are implicated in stroke, diabetes, rheumatoid arthritis, respiratory diseases, Alzheimer's disease, certain types of cancers, certainly pregnancy complications, and also cardiovascular disease. In fact, the link between cardiovascular disease and periodontal bacteremias is so strong that it is now considered that periodontal bacteremias are a direct cause of cardiovascular disease, not just implicated in it, but a direct cause of cardiovascular disease because of 4 mechanisms of action. One, with aggressive periodontitis, that in general, those periodontal patients have twice the level of circulating low-density lipoproteins in their bloodstream. Secondly, with chronic periodontal infections, the vascular endothelium, the lining of these cardiac vessels, becomes much more permeable and much more porous. And also with chronic periodontal infections, those lipoproteins, the circulating lipoproteins in the bloodstream, become stickier and bind more readily to the arterial walls. So that if you were to resect and examine a section of cardiac plaque, coronary artery plaque, under a microscope, you will see the same bugs, the same periodontal bad actors that we find in the mouth. Professor Ira Lamster, who was at the time the dean of Columbia University Dental School, wrote a landmark article in JADA, and the title of that article was Antimicrobial Mouth Rinses and the Management of Periodontal Disease. And his take-home message was that a daily oral hygiene regimen that includes the use of an antimicrobial mouth rinse reduces the risk of developing periodontal disease and helps control its progression. Waterpik Corporation has published their own studies, and they've shown that rinsing alone allows the rinse to reach to 21% of the depth of a 6-millimeter pocket. Yet with Waterpik's pickpocket subgingival irrigation tip, that irrigant can reach to 90% of the depth of a 6-millimeter pocket, delivering a medicament to the base of the pocket where the infection has arisen. As good as povidone-iodine is, it has disadvantages. It stains, it has an off taste, it's unstable when it's diluted, and we'll expand on that in a minute. Also, it's only moderately effective. We talk about how great it is, but it's only moderately effective. How do we know? Well, the FDA, in addition to chlorexidine gluconate, has also issued recalls for povidone-iodine. Why? Because of bacteria living in the povidone-iodine. It sounds a little incongruous. If this is an antiseptic agent that's supposed to kill bugs, why is it living? Why are the bugs living in that antiseptic agent? Well, in fact, there was an outbreak at Columbia Presbyterian Hospital in New York of spinal meningitis, and the Department of Anesthesiology at Columbia Presbyterian were really taken back, because there was a rash of patients who developed spinal meningitis, and they actually traced it to contaminated povidone-iodine. They were using the povidone-iodine as a pre-injection skin prep on the back before spinal anesthesia was performed, before they injected into the spinal fluid. But rather than knocking down the bacterial load on the skin, they were actually increasing the bacterial load on the skin because that povidone-iodine was contaminated. How did they know? Because they confiscated every single open multi-use bottle of povidone-iodine in the hospital, brought them to their pathology laboratory, and found that fully 10% of those open bottles were contaminated with bacteria. We mentioned the instability of dilute povidone-iodine. Well, this is important, particularly because of the ADA's recommendation in their interim COVID guidance to either use hydrogen peroxide or to use 0.2% povidone-iodine, which is a 50-fold dilution from the commercial 10% povidone-iodine that you get from your dental supplier as an antiviral pre-rinse. Well, Professor Colin Nuckolls, a professor of material science of the Department of Chemistry at Columbia University, had published an article called Chemical Considerations Related to the Dilution of Commercial 10% Povidone Iodine for the Use in the COVID-19 Pandemic. And essentially what he found was that when you dilute povidone iodine, the pH changes. And when the pH changes, that the povidone iodine rapidly becomes unstable, possibly toxic, but certainly rapidly ineffective. Take-home message: if you're using povidone iodine as a antiviral pre-rinse, you need to be diluting it each and every time for each and every patient. You can't prepare the dilute povidone iodine solutions in advance and expect them to remain stable and effective over a period of time. So in a matter of minutes, it starts to lose its effectiveness. There was an important study that was published in the very prestigious scientific journal Nature in November of 2021. And what they did in this study is they took a number of hospitalized COVID patients, and they wanted to see which antiseptic rinse was best able to knock down the viral load for those patients. So they first had these patients, they evaluated their saliva at what they called baseline before any treatment. And out of those 84 patients in this multi-center, randomized, double-blind, placebo-controlled study, they evaluated cetylpyridinium chloride mouthwash, chlorexidine gluconate mouthwash, povidone iodine mouthwash, hydrogen peroxide mouthwash, and also they used sterile water as a negative control. So after they established the baseline levels of virus in the patient's saliva, in the hospitalized viral COVID patient's saliva, they measured the patient's saliva 30 minutes later, 60 minutes later, and 120 minutes later to see what kind of therapeutic effect there would be following the use of those antiseptic rinses. And what they found was the following. They found that for the povidone iodine, for the hydrogen peroxide, for the cetylpyridinium chloride, for the chlorexidine gluconate, none of them were able to reduce the viral load in more than half those patients by at least 90%, not one of them. And in fact, they further found that none of them were any better than sterile water as an antiviral agent. And in fact, their concluding remarks were, our data show that salivary viral load in COVID-19 patients was not reduced by any of the tested mouthwashes. Okay, so if we know what doesn't work, let's take a look at what might work. So if you look at the schematic, all those, the schematic on the left, next to the povidone iodine, you see a box with a bunch of red circles in it and one blue circle. The red circles represent iodine atoms other than molecular iodine. The blue circle represents molecular iodine. So that's a schematic representation of povidone iodine, the same way you would buy it from your dental supplier. We call it povidone iodine as if it was one thing, as if it was iodine. It's not. Povidone iodine is actually a dynamic equilibrium of several different species of iodine, several different species of iodine. Of those different species of iodine, there's an aggregate of 31,600 parts per million total iodine. All those iodine species added together. The one species of iodine within that aggregate of all that iodine, which is present in the least supply, which is available only in trace quantities. In fact, at only 2 to 3 parts per million is molecular iodine, I2, molecular iodine. Why is that important? Because it's molecular iodine, which is the only biocidal species of iodine. It's only present at 2 to 3 parts per million of povidone-iodine. The rest of those tens of thousands of iodine atoms in parts per million don't kill germs. They're not biocidal. They contribute to staining. They contribute to toxicity. That's the iodide. That's the triiodide. That's the hypoiodous acid. That's the iodate. Those different species, which are present in much greater supply, don't kill germs. So it's only the molecular iodine which is biocidal. So one can say, well, okay, so if we know that, then why not just add more molecular iodine and have a stronger, more effective povidone-iodine? The reason is because molecular iodine is unstable. It doesn't remain as molecular iodine. It morphs into one of the other species of iodine. So no matter how much additional molecular iodine you add, it doesn't stay as molecular iodine. So in povidone-iodine, essentially you are limited to 2 to 3 parts per million of total of molecular iodine, and that's its activity level. For decades, researchers have been trying to increase the level of molecular iodine in povidone-iodine or in iodine solutions, other iodine solutions, and have been unsuccessful because it is not stable. It wasn't until 2017 when the newer variety of molecular iodine oral rinses became available. These are patented rinses which are stable at high levels of molecular iodine, and at the same time that the molecular iodine is boosted up from 2 to 3 parts per million as in povidone-iodine to 300 parts per million, or as much as 300 parts per million. The other species of iodine, the other thousands of parts per million of other iodine species are suppressed and stabilized at trace levels at just a few hundred parts per million, right? So molecular iodine, the only biocidal species of iodine, and it's present in povidone-iodine at only 2 to 3 parts per million. If you look at the vial on the right, you'll see a typical povidone-iodine solution is your betadine. The vial on the left is just as biocidal, just as effective as the vial on the right. That clear vial on the left, in this case, contains 3 parts per million molecular iodine. If you saw it in real life, you'd think it would look just like water. Yet it's just as strong and just as effective as any povidone-iodine. That same solution, that molecular iodine solution, could have been formulated at 25 parts per million, 50 parts per million, 100 parts per million. The amount of molecular iodine could have been stabilized at a particular level depending on the need or the application. This table shows various concentrations of povidone-iodine. The top row represents your typical 10% povidone-iodine, which you get from your dental supplier. Each succeeding row down, just a small amount, just 1 or 2 parts per million additional molecular iodine was added. No other change. So that finally in the lower row, lowestmost row, you have just under 5 parts per million of molecular iodine, I2, 4.88 parts per million. Yet in the top row, the effect on poliovirus, That top row, the 10% povidone-iodine, with, in this case, 0.17 parts per million of molecular iodine, only achieved a 0.6 log reduction of poliovirus after 15 minutes. So if you started with 1 million viruses, that's like leaving over 460,000 live viruses. The same thing with adenovirus, only a 0.6 log reduction. Yet, when you add just, the only change, you add just 1 or 2 parts per million additional molecular iodine, and you finally get to the bottom row at less than 5 parts per million, there's complete inactivation of poliovirus. There's complete inactivation of adenovirus, all with the addition of just a small amount, trace amounts of molecular iodine. Take-home message: when you increase the dose of molecular iodine, you increase the efficacy of that solution, and that happens in a dose-dependent manner. Doesn't make any difference whether it's adenovirus, poliovirus, or any other virus, or in fact, any other microbe. The same is true of all of them. Molecular iodine was shown to be effective as a professional pre-rinse. So for rhinovirus, at 30 seconds contact time, a 25 part per million molecular iodine solution was completely effective against rhinovirus. By the way, that's 1/4 the strength of the current molecular iodine oral rinses which are available. When you compare that to a very common oral rinse, which is commonly used, which contains essential oils and 21.6% alcohol, that was completely ineffective against rhinovirus. And for cetyl pyridinium chloride and 15% alcohol, another very common oral rinse, that oral rinse is 750 times less effective than the molecular iodine. And for cetyl pyridinium chloride alone, forget about it, completely ineffective. When you compare povidone-iodine to molecular iodine solution, for Staph aureus, povidone-iodine can completely inactivate Staph aureus in 5 minutes. Molecular iodine does it in 1/10 the time, complete inactivation in 30 seconds. For poliovirus, where only a 0.6 log reduction was achieved in 15 minutes, you get complete inactivation of poliovirus after 90 seconds with molecular iodine. And when you compare molecular iodine to chlorexidine gluconate, in the top row you see for coronavirus, and we discussed this already, that a 5% chlorexidine solution achieved a 3 log reduction after 1 hour of exposure. Yet for molecular iodine, within 30 seconds, you get complete inactivation of coronavirus. For rhinovirus, where chlorexidine gluconate had no biocidal activity whatsoever after 30 seconds, with molecular iodine, after 30 seconds, you had complete inactivation. And where chlorexidine gluconate did have a formidable showing at 15 seconds for Fusobacterium nucleatum, a prominent periodontal bacterium, with a 4.29 log reduction, for the same time span, for 15 seconds, molecular iodine was 100 times more effective. And for chlorexidine gluconate, for strep mutans, a 0.19 log reduction in 15 seconds, a horrible showing, yet in the same 15 seconds, strep mutans was completely wiped out by molecular iodine. There was an important study that was done this past year, which compared several different antiseptic rinses for their effectiveness against 2 prominent periodontal bacteria in the presence of human saliva. Why in the presence of human saliva? Because Salivary proteins inactivate most antiseptic rinses. So if you're looking at just pure laboratory data or in vitro data, and it does not include whole human saliva as a organic challenge, then you're not getting realistic information. So all of these rinses were tested in the presence of saliva. The molecular iodine rinse achieved complete inactivation for both Fusobacterium and Prevotella in 30 seconds. The chlorhexidine gluconate rinse was the next most effective rinse. It achieved a 28 times less effective showing than did the molecular iodine for Fusobacterium, and a 730 time less effective showing for Prevotella. The other rinses went downhill from there. So either thousands of times or tens of thousands of times worse showing than the molecular iodine. The molecular iodine rinse was then tested for two other periodontal bacteria, Porphyromonas gingivalis and also Tannerella, and also at 30 seconds, also in the presence of saliva, and they also completely inactivated both of those other periodontal organisms. The Institute for Antiviral Research at Utah State University tested 4 different rinses for the antiviral efficacy against SARS-CoV-2. And they tested 2 rinses which were recommended by the American Dental Association, which were the hydrogen peroxide and povidone-iodine. And because chlorhexidine gluconate is so frequently used, they also tested that, and they tested a 100 part per million molecular iodine rinse. They tested it both at 30 seconds exposure and also 60 seconds exposure. The only rinse to be fully effective, got complete inactivation, was the molecular iodine rinse, and it did that at 30 seconds exposure. None of the other rinses were fully effective, not at 30 seconds and not at 60 seconds. 2 of the rinses showed cytotoxicity. The hydrogen peroxide, which was cytotoxic even up to a 1,000-fold dilution, and the chlorhexidine gluconate was cytotoxic even up to a 100-fold dilution. Neither the povidone-iodine nor the molecular iodine rinses showed any cytotoxicity. That study was written up and published in the International Journal of Experimental Dental Sciences, and it's part of your handouts for those who are interested in learning the details of that study. Clinicians report did their own investigation, and they compared the biocidal. For those of you who are not aware of Clinicians Report, they're a very well-established, well-respected nonprofit dental clinical research organization. They've been around for 40+ years. They have over 100,000 dental offices as paid subscribers to their service. And they're very similar to Consumer Reports, only for dentistry. And so they compared a number of different rinses for their biocidal efficacy against SARS-CoV-2. And what they found was that a 100 part per million molecular iodine rinse was 275 times greater virus reduction compared to the 0.2% povidone iodine, and that the 100 part per million molecular iodine rinse was the only product to be shown effective in the presence of saliva. And that's Clinicians Report points out that saliva can cover, coat, and protect viruses from exposure, and that saliva neutralizes antiseptics. And this electron microscope uh, uh, scanning image on the right, you'll see those blue rods are, this is of the upper respiratory tract. The blue rods are cilia. The red globes are SARS-CoV-2 virus, and that chartreuse netting on the right is mucus, which serves the same protective effect as saliva. And clinicians' report points out that product claims for antiseptic kill based solely on clean laboratory tests failed to provide clinicians with essential realistic information that a 100 part per million molecular iodine formulation was not substantially affected by the presence of fresh human whole saliva. And clinicians' report recommends that if you're looking for an antiviral rinse or looking to get the best effect for an antiviral rinse, have the patient rinse with 2 consecutive 30-second rinses. The first rinse will have some antimicrobial activity. The second 30-second rinse, immediately consecutive, will be able to attack the virus directly on the tissue because it won't have the saliva to protect the viruses. It was determined in a study of 442 COVID patients that on average they had approximately 1 million copies of living virus per milliliter of saliva. And since there's about 1 milliliter of resting saliva in males and females, a little bit more in males, a little bit less in females, so you're talking about, on average, in resting saliva, that a COVID-infected patient has about 1 million copies on average in their mouth, and that can go up to 100 million copies. Yet the consensus on infection control experts is that it only requires 1 to a few hundred living viruses in order to be able to initiate an infection. And the reason that is particularly important to get maximum viral inactivation is because even sub-infectious doses can, in aggregate, cause an infection. And in fact, from the London School of Tropical Medicine, we learned that studies in mice have also shown that repeated exposure to low or sub-infectious doses may be just as infectious as a single high dose. So it's crucial for us to limit all possible exposure to COVID, including to asymptomatic individuals shedding small quantities. And from the chairman of the Department of Virology and Infectious Diseases at Imperial College of London states that the severity of COVID-19 illness is dependent on the virus quantity in the infecting inoculum, in the initial inoculum, and that in general, respiratory viruses, how severely ill you become is largely determined by how much virus actually got into your body and started the infection off. And from the University of Birmingham, from their microbiology department, they point out that with SARS and MERS coronaviruses, that with exposure to higher doses, and that these are associated with worse outcomes. And this is also likely the case of COVID-19 as well. So the higher the initial infecting dose, the worse the potential outcome. Okay, so this slide is a summary of the work done by clinicians' report. And if you look at the bottommost row, it shows that in the data that was amassed by clinicians' report, they show that for either chlorexidine gluconate or for hydrogen peroxide rinses, that if you start off with 1 million viruses, that after the rinsing, you'll wind up with 100,000 live viruses remaining. With povidone-iodine, you'll wind up with 1,000 viruses remaining. And with molecular iodine, you'll wind up with no viruses remaining. Molecular iodine oral rinse completely inactivates also the Delta variant of SARS-CoV-2, also within 30 seconds, and also in the presence of saliva or not. Either way. Molecular iodine during the pandemic has been used in dental offices obviously as a pre-procedural oral rinse. It's been used in the water reservoirs of ultrasonic scalers, high-speed handpieces, and three-way syringes. It's been used to protect patients' hands and also the staff use for hand protection. It's also been used as a nasal spray and a nasal cream for additional protection. And also it's been used in ultrasonic room humidifiers and aroma diffusers to knock down the viral load in aerosols. And it's been used in the cleaning of high touch surfaces. Molecular iodine is also available as a gel, and this is particularly effective in full arch trays. Either Perioprotect makes a suitable tray, or Denmat makes a suitable Perio tray. Those same Perio tray can be made in your office as a suck down tray with soft EVA material, ethyl vinyl acetate, and that's 3 millimeter tray thickness. It's a flexible tray, and its benefit in a tray is that because of the hydraulic pressure, when the tray is placed over the teeth, it forces the gel down into the periodontal spaces and it holds it there. So it resists the weeping of the crevicular fluid from the periodontal pockets, which may wash out a liquid that was put into place. And the wear time with molecular iodine for these periodontal trays is only like 5 minutes a day. So very short wear time necessary and excellent results. It's been used by a number of periodontists for both moderate and severe periodontal disease. Okay, so we mentioned earlier that molecular iodine is an essential nutrient. And to give you an idea of what the level of safety, just because it's an essential nutrient doesn't mean that you can ingest copious quantities and not have some sort of an effect or a detrimental effect. Because even if you drink enough water, you can wind up in trouble. There have been people that have died from overdosing on water. But you should be aware that there was a study that was done some years ago for the treatment of fibrocystic breast disease. This was an FDA-sponsored study that was done in the United States with the use of molecular iodine tablets being ingested every single day. 1 tablet per day, a 6 milligram molecular iodine tablet ingested. In this study, there were over 1,000 women, and they wanted to see the effect on reducing fibroid cysts of the breast. And the rationale for that was that in Japan, that fibrocystic breast disease is almost non-existent. Yet, when those same Japanese women who don't get fibrocystic breast disease in Japan, when they move to Europe or they move to the United States and they adopt a Western diet, then they develop fibrocystic breast disease at the same rates as their Western counterparts, right? So it's been assumed that this was diet related. And in Japan, the health statistics are much better than ours in the States. There's a 5-year longer life expectancy. There's much less heart disease and a number of other important health parameters. and they have diets which are rich in iodine. The average dietary intake of iodine in Japan is twice that in the United States, and it gets up to as much as 50 times more, 50 times more in Hokkaido, Japan. The average dietary intake of iodine is 50 times what it is in the United States, and they're healthier. So in this study, where 6 milligrams of molecular iodine was ingested every single day, swallowed every single day. By the way, that's the equivalent of drinking 6 ounces of a molecular iodine oral rinse, drinking it every single day for 6 months. There was no reported adverse events. And by the way, because this was an FDA study, every week these women were examined by physicians, and they had blood work taken. So they were looking very carefully at the levels of iodine being ingested. So no adverse events. So there's really a very, very wide safety margin for the use of molecular iodine oral care products. Many people have heard that with seafood allergy, particularly shellfish allergy, that there have been reactions to shellfish which have been attributed to iodine. Well, that's a misnomer which has been discredited multiple times in the medical literature, that the sensitizing protein tropomyosin is the culprit, not iodine. The protein in shellfish muscle, tropomyosin, causes these sensitivity reactions. Also, there's been a number of frequent and severe reactions to radiocontrast media or diagnostic imaging media. And because much of that radiocontrast media is rich in iodide, then people are concerned that they have a reaction to iodine. It's also been shown that when the iodide remains constant, but they swap out some of the excipients, which are highly ionic, for non-ionic excipients, keeping the iodide constant, that the severity and also the frequency of these reactions falls off dramatically. Beyond that, in molecular iodine oral care products, there is no iodide. Remember we talked about the suppression of the other species of iodine? There is no iodide in molecular iodine oral care products. Thyroid toxicity is important, and particularly because of iodide. Why? Because iodide is required for the synthesis of thyroid hormones. Thyroid gland selectively uptakes iodide, not molecular iodine. There's no more molecular iodine in the thyroid gland than any other tissue in the body. If a patient feels, or if there's a concern that a patient may have an iodine allergy, and by the way, you talk to an allergist, and the allergist will tell you there is no such thing as a true iodine allergy because it's required by our bodies. It's required even by the bodies of those who think that they're allergic to it. Okay? You can be sensitive to different levels of iodine, but you can't be allergic to iodine because it's required by our bodies. It's required by all mammals. And so if somebody is concerned that there is that they may get a reaction to iodine, my suggestion is that you just take a few drops of a molecular iodine oral rinse, put it on the bare upturned forearm of the individual, and wait a couple of minutes. If there's no erythema, if there's no swelling, then I wouldn't be concerned about it at all. Even though we're practitioners of the mouth, we also need to be concerned about the nasal cavity because there's more virus lurking in the nasal passages than there is in the entire mouth. And in fact, we found out from our colleagues that this is the case, and that it's the most prominent breeding ground for SARS-CoV-2 virus is the nasal passages. And we learned that from the journal Cell that the nasal surfaces are the dominant initial site for SARS-CoV-2 infection. We learned from the Ear, Nose, and Throat journal that the highest viral loads were within the nasopharynx. We learned from the New England Journal of Medicine that higher viral loads were detected in the nose than in the throat. And we learn from the Journal of the American Medical Association, the otolaryngology edition, that SARS-CoV-2 is primarily transmitted through contaminated nasopharyngeal secretions. There was a study that was done, or that was commissioned by the NIH. It was performed at North Carolina School of Medicine, and what they found was that SARS-CoV-2 virus can be exhaled from the nose during normal tidal breathing. So what am I saying? I'm saying that when your patient is sitting in the chair and they're at rest, they don't have to be coughing, they don't have to be sneezing, they're at rest, they can still be contributing or shedding viral particles from their nose into an aerosol. And we also learn from a joint study from Johns Hopkins Medical Center and also Harvard Medical School that vaccinated patients, boosted patients, even though they're asymptomatic, even though they may not have an active infection themselves, they still could be infected and they could still be a carrier and transmit live virus from their upper airway. And with the nasal mucosa, we're not just interested in viruses, we're also interested in MRSA. Why? Because at the University of California School of Medicine, they found that 20% of the adult population has its nasal passages permanently colonized with MRSA, Staph aureus, methicillin-resistant Staph aureus. And that intermittently, that can rise to as much as 60% of the adult population. Also, by the way, they found that 3 times as many animals responded to intranasal application of molecular iodine compared to povidone-iodine. There was a couple of very interesting studies that were done on dogs, and this was for plaque reduction. These were double-blind studies, diet-controlled clinical trials that were done under the auspices of the VOHC, the Veterinary Oral Health Council. And what makes these studies so interesting is that they found that with the addition of a nutritional level of molecular iodine, a few drops of molecular iodine placed in the pet's drinking water each and every day, that there was a 44% reduction in dental plaque compared to the dogs that did not have that added to their drinking water. 44% reduction. What makes that really interesting is that in an article published in the Journal of Veterinary Dentistry, where veterinarians supervise the brushing of dogs' teeth either weekly or every other day or every single day, with the every single day brushing, they found that there was a 37% plaque reduction, the maximum plaque reduction they were able to achieve by brushing, which was significantly less than the 44% plaque reduction achieved by adding a few drops of molecular iodine to the pet's drinking water without any of the hassle of having to hold the dog still while you brush its teeth every single day. With periodontal disease, we know that it increases the severity of COVID-19. There was an article published in the Journal of Clinical Periodontology, which points out that with periodontal disease, you are 3 times more likely to be admitted to intensive care, 4.6 times more likely to need a ventilator, and 8.8 times more likely to die. The CDC points out that we should be on the alert for monkeypox transmission in dental offices, that it's transmissible by direct skin-to-skin contact, that even when we touch objects, fabrics, or surfaces that are used by someone with monkeypox, or with prolonged face-to-face contact, or contact with respiratory secretions, either oral or nasal, that there's a potential for a transmission of monkeypox in a dental office. And that rashes, intraoral rashes, can be a monkeypox rash. The good news is that monkeypox is an enveloped virus, meaning that it's easily killed. It may be very contagious, but it's easily killed with a good antiseptic rinse. Okay, so with that, we're going to take some questions, and if we'll try to get to as many questions. There's a lot of folks here, so we'll try to get as many questions as we can. If we run over time-wise and you don't get your questions answered, you'll be able to reach me through the handouts, and we'll be happy to try to get any other questions answered as best we can.
I have those listed for you if you see under the questions, Dr. Moskowitz.
Okay, good. I've noticed that in using rinse as a pre-rinse treatment, when some patients expectorate, goes from golden color to nearly clear. Why is that? What is happening that some do and some don't? Actually, it has to do with the when the iodine comes in contact with microbes or proteins, that a portion of it can become inactivated, and that's where you see a color change. So you're seeing a diminution of the level of active remaining iodine because it's done its work, and that shows that it's been used up in the process. So it's been working for you. I'm confused with the 2 30-second consecutive rinses. Is that all rinses will be effective at the second rinse, or only the rinse? Okay, so all rinses will not be effective with 2 30-second rinses. In the case of clinicians who reported on this, the only rinse that they recommend as a pre-procedural rinse is a molecular iodine rinse. And why? Is because that's the only one shown to be effective in the presence of saliva. So other rinses have varying degrees of effectiveness, but there's a huge difference between the effectiveness of these different rinses. So it's a matter of degree, but the only one that we could say with confidence that would be effective with which actually is effective with a single 30-second rinse, but you can, it's like belt and suspenders. I mean, if you're going to the trouble of protecting yourself, then you want to make sure that you're doing as much as you can to protect yourself, and that's why the 2 30-second rinses come in. Okay, so let's see. Okay, I'm also confused about the monkeypox. Does this rinse help kill it? A molecular iodine will kill the monkeypox virus, so that patients have more bacteria than those. So those patients have more bacteria in the mouth than those that when they expectorate. Wendy, I'm glad I'm using it then. Right. Okay, what are your thoughts about iRinse? If you don't mind, I'd rather not talk about specific products because you're getting credit for this. This is part of your webinar. If for those who would like to stay on and learn about molecular iodine products, what's available, where they can be gotten from, what kind of specials are available on them, we'd be happy to talk about products. But in fairness to other the others in the audience, let's save that question to for when Angelique Adderley, our Director of Investor Relations, offers some guidance on molecular iodine products. I use molecular iodine products and I love it. Thank you, Thomas. You've got plenty of company. Okay. Dr. Rollins, have I missed any? Okay.
I do not think so, but let's check in with everybody and make sure if there are any outstanding questions here. What cancers are linked to periobacteremia? Off the top of your head.
Oh, what cancers are linked to periodontal bacteremia? There's mesenchymal cancers of middle tissue, like breast cancer, stomach cancer.
Question here about my mom says she's allergic to iodine. Is that possible? I think you addressed that, but
many people think that they're allergic to iodine, but in most cases, well, in almost all cases, they're not. Some people may have had a reaction to povidone-iodine because povidone-iodine has a lot of excipients in there, a lot of extra ingredients which are not iodine, and also they have so many molecules of iodine which don't kill germs, which are not necessary for biocidal activity because they don't contribute to biocidal activity. So a number of people may have gotten some sort of reaction to povidone-iodine, not because they're allergic to iodine, but because they've had a reaction to povidone-iodine because of the gamish of all the different ingredients in povidone-iodine.
There is a question about ioVet. We can hold that until the product presentation, but they're asking if it contains molecular iodine.
It does. It does.
Okay.
Yes, it does.
I knew that, but I wanted to hear it from you.
Right. The same molecular iodine that's found in the oral care products. But I just want to, this really should be saved for the product portion of the presentation. But because it's such an important safety point, I want to mention it now. Just because I'm telling you that molecular iodine is used in the pet products, in the pet water additive, doesn't mean that you can substitute for your pet and use the human oral rinses and use it in the pet as a pet water additive, because because xylitol is used in a number of the oral rinses, molecular iodine oral rinses, and xylitol should not be used for pets.
Okay, we have a question. Is that what they use for hospital imaging?
Is what they use for hospital
I
imaging?
think iodine.
They use iodide for hospital imaging, radio contrast media, or diagnostic imaging media. They use iodide. That is not present in the molecular iodine oral care products.
Should children use a pre-rinse with molecular iodine?
There's no contraindication for children to use it, and from the data that's been presented for the use of povidone-iodine for early childhood caries, that there's every reason why children should use it, both because of its effect for its periodontal effect or for plaque, as well as for its anti-caries activity.
Okay, we have one more question here. Subgingival irrigation, which would be more effective, chlorexidine or iodine? I bet I know what you're going to say there.
Okay. All right. Okay. If that's not a trick question,
it was a setup for you.
Right. Right. So chlorexidine gluconate has a proven reputation over time as a periodontal irrigation. But the data that has come out, independent data from universities and laboratories, shows that molecular iodine is far more effective against periodontal bacteria. In fact, in one slide that I pointed out, that it was 100 times more effective than Fusobacterium nucleatum when they were compared side by side. Fusobacterium is a very important periodontal pathogen.
Okay, well, we have covered the questions, except for any product-related questions. I think it's time to bring Angelique on.
Sounds good to me.
Do you see anything here? Okay.
Okay. All right. So thank everybody for your attention. I hope you got some interesting tidbits and helpful tidbits here, and I think you'll get some important information on how you can practically apply molecular iodine to your office with what Angelique has to offer you. So thanks again.
Thank you, Dr. Moskowitz. All right, everyone, we are going to have a product demonstration here. The continuing education portion is concluded. Angelique is going to talk about products now. This is not required for CE credit, but they are offering you a very nice special promotion and more information about direct product questions. Hello, Angelique.
Hello. Hi, Dr. Rowling, and hello, everybody. And thank you for staying on for this portion of our webinar. We are excited to tell you about the ioTech products, our entire lineup, and also give you some more information about some programs that ioTech is introducing for you as well. So as you can see on the screen, we do have our current ioTech international products. These are all products that are manufactured by us, and they're all domestically manufactured. The first one up we have is our ioRinse Ultra. Now, ioRinse Ultra is our first OTC drug product that we have launched. ioRinse Ultra is recommended for anti-plaque, anti-gingivitis. It is a ready-to-use rinse, so it does not need to be diluted for use. It can be used in office. It also can be used at home for your patients. ioRinse Ultra is available in soft mint flavor. It comes in 1 liter bottle sizes as well as a 16 ounce, which is also a half liter size. So the 1 liter size is 12 1 liter bottles per case, and the 16 ounce is 24 16 ounce bottles per case. Next up, we have our ioRinse ready-to-use formulation. This some of you may be familiar with this product. This is one of our very first products that we had. ioRinse ready-to-use is available in green apple or soft mint flavors. The soft mint flavor is the flavor that does contain xylitol. They're both available in 1 liter or 16 ounce sizes. 12 1 liter bottles per case and 24 16 ounce bottles per case. Again, the ready to use does not need to be diluted for use. It can be used at home or in office for pre-procedural rinsing. Next up, we have our ioRinse concentrated irrigant. The concentrated irrigant is used for water irrigation devices. So it can be used in office in your water irrigators, and it also can be used at home by patients in a device such as a water pick or other water flossers. It is diluted, so they can add a capful of the ioRinse concentrated irrigant into the tank of their water flosser. This is available in 1 liter bottle sizes. It is a green apple flavor, and again, there are 12 1 liter bottles per case. Next up, we have ioGel, which is our tray gel. This is a thicker formulation of the molecular iodine, and this is used in a periodontal tray for at-home use. So the patient would take some of the gel, put it into a tray, place the tray inside their mouth. They leave it in place for about 10 minutes, and then they will remove the tray, spit out the excess. ioGel is available in a 12-ounce bottle, and there are 12 bottles per case. On the bottom left, we have ioCleanse, which is our molecular iodine hand cleanser. This, it does not contain alcohol. You can spray it directly onto your hands, allow it to air dry. There's no drying of the skin. This does come with a spray head. There's 12 1-liter bottles per case, along with 12 sprayers in the cases. Next, we have one of our first of 2 nasal products. So Dr. Moskowitz did discuss the importance of protecting the nasal passages as well. ioMist is our saline-based nasal spray. This comes in a 1-ounce bottle with a mister top. This is a product that is used for individuals. It's not shared between people, so therefore it's something that can be recommended for your patients for them to use. They take it home, they can use it at their own discretion. And so we have our ioShield, which is our second nasal product, which is a much more economic solution for use in the dental offices. So if you are looking for something that can protect the nasal passages and protect the office from any viruses that could be expelled during the patient's visits, the ioShield is a much more economic solution for this, whereas the ioMist is a great product for the patient to take home. So the ioShield is simply applied with a disposable applicator inside the nostril. It's swabbed inside each nostril, and it gives a physical as well as the molecular iodine barrier. Now, the ioMist nasal spray is available 24 1-ounce spray bottles per case, and the ioShield is a 2-ounce jar, and there are 9 jars per case. I know we had a question earlier about ioVet. ioVet is our pet water additive. This is our first pet product. It's available in a 4-ounce bottle, and it also comes with a graduated dispensing syringe. So you can easily measure out a small amount of the liquid depending on your size of your pet's water bowl, and you dispense the liquid into the pet's water dish once daily, and you get all of the incredible benefits of the molecular iodine. This product does not contain xylitol. That's why it is specifically created for pets, so that it can be safe for them to use. The ioVet Oral comes as a kit, including the dispensing syringe, and there are 18 of the 4-ounce kits per case. Now, all of these products are available through our website in wholesale quantities. So if you go into the professional store, that's where you'll get the case quantities, which gives you professional pricing. If you go into the consumer store, they're available in individual bottles, and it is at retail price. So as a professional, you do want to go in, make an account, and you can click that button at the top of the screen on the banner. Use that promo code SAVEOCT. That's going to give you a 50% discount on our introductory kits. The introductory kits contain all of the products that you see on the screen. Our 7-product kit does not contain the pet product. The 8-product kit does. So if you click that banner, use the promo code, and this will be available for you until October 27th, which is next Friday. You can use that code to get 50% off the professional pricing on the introductory kits. So if you look at the pricing and the comparison to just an individual bottle at retail pricing, this is an extraordinary discount for you. Now, if you haven't already created an account, it will require you to create a login, and then you can get professional pricing. We have introduced our ioTech brand ambassador program. This program gives all dental professionals the ability to recommend ioTech products to their patients. It gives the patients a discount on the products through the consumer store, and it gives the dental professional a commission on the sale of the products. This is open for professionals who do not stock product. If you're not currently making a profit in your practice, you don't stock product and sell it directly to your patients, you can sign up for this brand ambassador program, recommend the products which the consumer would, the patient would go and buy through the consumer store, and you would still earn a commission. So if this is something that you are interested in, you simply scan that QR code. It's going to take you to a calendar where you can choose a date to attend an introductory webinar. You will learn all about the commission schedule as well as the discounts available to your patients. And we have a few time slots available, so you can go ahead and scan that QR code. That'll take you to a place where you can sign up for that ioTech brand ambassador program. Just recently, because of a lot of requests that we have been getting for more information, we are introducing lunch and learns through ioTech. Now, these are virtual lunch and learns where you will receive practical information for to use ioTech products for in-office use, as well as for patient at-home use. You'll also receive clinical tips for best treatment outcomes and building an important new practice profit center. So again, we do know that some offices stock product and some offices do not, and that is definitely your choice. But we want to make the ability to create a profit center available to everybody. So by attending these lunch and learns, which can be set up for your entire office, and they can be done virtually, you would be able to ask these questions and learn how to make a profit center in your practice, whether you stock products or not. If you send us an email at contact@iotechinternational.com, you can give us your information and we can reach out to you to schedule this. Or you can scan that QR code. It's going to take you to an online form. You fill that out and submit it to us, and somebody will reach out to you about answering any of your questions or scheduling a lunch and learn to get more information about the product side of ioTech International. In 2018, Clinicians Report did an evaluation of our ready-to-use oral rinse and our concentrated irrigant. In this evaluation, there were 250 patients. 125 patients used the concentrated irrigant in their water pick. 125 patients used the ready-to-use at home. The patients were taken from 50 offices, 5 patients per office. And this is just a quick evaluation of the results that they got back from after interviewing these patients. As a result of this evaluation, in 2019, Clinicians Report listed our products in their buying guide as a best product for 2019. They also listed, following the study that was done that Dr. Moskowitz discussed in the webinar, we were listed in their best product for 2022, and again as best products for 2023. This is a list of just a few of many key opinion leaders that do recommend the ioTech products. Any of these articles can be obtained from us if you aren't able to find them. Some of them are also included in your handouts. But if you're interested in reading any of these articles, we can just reach out to us and we can provide a digital copy for you or direct you as to where to read all the great things that was written about the ioTech products from these key opinion leaders. Like we discussed, there is a potential for profits in your practices through the sale of ioTech products. We do give professional pricing, and we also give bulk pricing. So our professional pricing is for case quantities. And if you purchase 10 cases or more, you're going to get an additional 15% off the bulk pricing. So this is just a quick breakdown or an illustration of how profits that can be made through the sale of ioTech products to your patients. For an economic comparison of oral rinses, we're always looking to save money with the products, but also give our patients the best products possible. Molecular iodine which is in our ioTech products, is still the most economic per liter with all the benefits that were discussed in this webinar. So these prices were standardized to 1 liter bottle sizes and taken from professional dental websites. ioTech product availability. This chart is available in your handout as well. These products are all available directly from us, and they're also available from different dental distributors. So if you are interested in becoming a customer of ioTech and obtaining professional pricing on our products or wholesale pricing, you can go to our website. Again, that banner is at the top of the screen, is going to take you into our website, and the code will give you 50% off the introductory kit, which will give you a chance to try all of our products. If you do have any trouble with the website, or if you want to answer more questions, you can reach out to us at the number at the bottom of the screen. We are available Monday through Friday, 9 a.m. to 5 p.m. Eastern Standard Time. Or you can reach out through our website. We do have a messaging feature on the website, or send us an email and we'll be happy to answer any questions about products or ordering questions that you may have. If you do not get to use the code through the website, or if you prefer to call it in, we'll also honor those that discount code over the phone. Now, I am available, and so is Dr. Moskowitz, here to answer any follow-up questions that you may have. And if you don't get your questions answered, please feel free to reach out to us through phone call or through email, and we'll be happy to answer anything that you may have. Okay, and I'm going to check and see what kind of questions that we have here. And Dr. Moskowitz is here to help us out.
Angelique, I have a question again about what the promo code applies to.
Okay, great. The promo code applies to our introductory kits. So if you go into our professional store and you look for, there's a 7-product kit as well as an 8-product kit. Either one of those kits will work with the promo code, and it'll give you 50% off the price that you see online. That's already wholesale pricing, so you're getting an additional 50% off. The only difference between the kits is that one of them includes the pet product. And I know some people may be interested in the pet product. And if you're not, then you want to go with the 7-product kit.
And again, there is a banner at the top of the screen, and the promo code is right there on the button. If you tap on that banner, it will take you to their URL, and you can save that, bookmark it to your device if you want to take the information back to your practice on Friday. I'm sorry, Monday. Today is Friday. On Monday, yeah. Or unless you're working tomorrow, and some of you are.
And make sure you go into the professional store, because that's where you will get case quantities at wholesale pricing. The consumer store is available without a prescription for your patients. If they are interested in ordering, they can go into the consumer store. But the professional store is only case quantity pricing.
The dosing for ioVet for cats and dogs, is it the same, or is it based on weight? You know, if you put a water bowl out for one, they're all going to.
Yes, it's based on the amount of water that's in the bowl itself.
Okay. What about a concentrate in mint? Is that?
Currently, we only have the concentrate in a green apple flavor. We do not have it available in mint currently.
Question about keeping down the risk of COVID using molecular iodine.
I'm just going to find the question for you.
All right, while Angelique is looking for the question, I could tell you that there was a clinical study that was done by St. Joseph's Medical Center in Paterson, New Jersey, where they used a molecular iodine hand cleanser, molecular iodine nasal mist, and molecular iodine oral rinse to help to cut down on the COVID infection rate on their healthcare workers. And even though they didn't wind up with enough patients to publish on the study, they did find that there was no safety concerns with the use of these products, and that none of the healthcare workers who did use the products developed COVID. None of them.
Question here from Wendy: is the ioVet cat and dog safe for both, or is the formulation different per species?
It's formulated for both.
It has to do with the amount of water that the animal intakes. So obviously, a small kitten drinks less water than a Great Dane.
Which rinse is best for someone with braces on?
All right. Any of the rinses, any of the molecular iodine rinses would be an excellent choice. All of them contain the same level of molecular iodine.
Question about the iogel in the perio tray. How long do you wear it per day?
5 minutes is all that's necessary. If you're not sure that the patient is going to follow instructions carefully, then you might want to tell them 10 minutes. But 5 minutes is all that's required.
Okay.
Right? And I wouldn't use it for more than that. You don't need to.
And I just do want to point out to Wendy, the cat and the dog, they are opposite sides of the same box. So if you were to get the product, you'll notice that they are both on the same box, but one is just turned the other way. So just to avoid any confusion there, it's the exact same product.
Wendy would like to know also, is the iogel in trays good for caries control?
Yes.
And for the gel, can we place it subgingivally with a syringe? If so, for how long?
It's unlimited. The iogel placed subgingivally. First of all, these molecular iodine products were developed for chronic use, for long-term, everyday use. So people could use these products for years and years and years. In fact, when you turn that around and say they should be using them for years and years and years. So that's not a concern. And the amount that's used subgingivally is such a minute amount, it's not a concern.
Any other questions? See what we have here. How long do you leave it subgingivally before rinsing?
There's no reason to rinse. Or if you're talking about before you can rinse, then I'd want to make sure that it was in place for 5 minutes.
Okay, any more questions? And again, if you tap on the banner at the top of the screen, you can bookmark that URL. We also have the direct link in the chat area with the promo code. I'll repost that for you.
And if you are interested in more product information, just give us a shout out at that email address or scan that code, and we'll be happy to get you more product information about use in the office as well as sales to your patients.
Samantha wants to know if you can use the promo code more than once.
Yes. It's going to be available to you until Friday. So if you want to try, if you have multiple offices that want to try it, you can go ahead and use that promo code to get on those introductory kits.
Rose would like to know if you ship to Alaska.
We probably would need to check out the different rates. So if you give our office a call at extension 4, they will definitely be able to help you out with shipping.
Yeah, right. And then in addition to that, Patterson Dental Supply and Burkhart Dental Supply, both of which I believe have a presence in Alaska, carry some of our products. But for the full line of products, then you'd want to go to ioTech's website.
Okay. Any closing remarks there, Angelique or Dr. Moskowitz, before you go off and have your weekend?
Well, we do want to thank everybody for remaining on. We know it is your Friday afternoon, so we want to thank everyone for remaining on with us during this product portion of the webinar. And we look forward to working with you in the future.
All right. Well, thank you so much, everyone. Thank you, Dr. Moskowitz. Thank you, Angelique.
Thank you, Dr. Wilson.
Our pleasure.
And keep up the great work over there.
Thank you. Same to you.
Thank
Okay.
you. Good
All right,
night now. All right, everyone, I'm going to go ahead now and close out. You'll be redirected to the quiz. I see Debbie wants to know how to reach it. If you have to be logged out as well, but we're going to log you out. You'll be taken to a screen to complete it right now. You'll also be sent an email very shortly from noreply@clickmeeting.com, and read it. It says, thank you for attending. It will have the link to the quiz in the handout again. So thank you, everyone. Have a terrific weekend. And we look forward to having you join us again soon.